Welcome back to Sports Plus. I'm Michael Nast, and this is the infamous Paul Salfen. And tonight we're going to kick off our initial health and fitness segment. And for that, we traveled to Odessa, Texas, where Paul volunteered for a heart stress test at the Healthy Heart Center run by Dr. Suresh Gadasalli. And how was that experience for you?
Well, just like any stress test, it was a little physically stressful. Just getting on any kind of treadmill is interesting, especially when you've got a bunch of spectators. So it was actually quite interesting. But the thing that really got me was when I got the sonogram on my heart. And it's really, really interesting to see your heart and to know that, hey, maybe there's something wrong. It also caused me to call my parents and ask about heart health in my family. And there were some things I didn't know. So, you got to take care of your ticker, so you have to make sure that you're doing all right. Let's take a look. All right, we're back on Sports Plus, and I'm joined by Dr. Gadasalli at the Healthy Heart Center here in Odessa. And, I'm really excited to get checked out today because, you never know. Something could be wrong. I should say excited, but also nervous.
Paul, welcome to Odessa, first of all.
Thank you.
Yeah, we have a state-of-the-art clinic here that we can help you, and we can investigate, what problem potentially you could have. So once again, welcome.
Great. Yeah, happy to be here. Now, what exactly are we going to go through? Because I think some of the guys on the crew were messing with me when they were talking about different probes and things like that. It's not really that invasive, right?
No, it's not. Initially, when somebody comes in for an evaluation by a cardiologist, they typically have some concern, or they may have a symptom such as chest discomfort, chest pain, shortness of breath. They probably feel fatigued, they may be lightheaded, or they can feel their heart beating. And they may have certain risk factors. People in the family may have had a heart attack or a stroke or needed bypass surgery. So they would have all of these fears in their mind, and then they would come to see a cardiologist. Typically, they could be referred by another physician who's already seen them and has a suspicion for having heart trouble. So when somebody comes in, we tend to first calm them down, reassure them that things are not invasive all the time. We do what is called a history and physical. We meet the person. We're going to call them a patient at this time since they've come in, and at that point do a careful history, finding out what their problem is, when did it start, what's going on, what are the fears in their mind. Then do what we call a risk assessment profile, and then run a basic examination of the heart and the blood vessels that we can, amongst other things. Use a stethoscope to listen to their chest, and do a simple EKG. That would be the first step.
So would you say most people come in here for preventative care or when something's wrong?
A majority of the people see a cardiologist when they have a symptom. A minority, a few people do come in for preventive care, especially if they have high cholesterol or things of that nature. Okay, and so I'm going to go through all these tests. Now I'm just kind of wondering what it's going to look like. Am I going to be in some backless gown? Is this going to be kind of horrifying in a sense, or? Absolutely not, Paul.
Okay, it's nothing to worry about, right?
Nothing to worry about. Your dignity will be maintained, and we'll just, you'll of course have to get your coat and your shirt off for us to apply the electrodes to do the EKG, and we might be doing an echocardiogram, which is a sonogram of your heart. It'll look at your cardiac chambers. We'll look at the valves of your heart. We'll look to see how your heart muscle is moving if you need that test, and then if you do have an indication and you need to have a stress test, we'll be putting you on a treadmill. But again, no backless hospital gowns.
Well, that's really, really reassuring to know. Now, it's really neat to think about a heart sonogram. Are you still fascinated to this day, just watching the human heart beat as it does?
Oh, absolutely. It just is really fascinating and provides a tremendous amount of information to a cardiologist. So it's one of our vital tools that we use, to measure the dimensions of the heart, and then if somebody has had heart trouble, we measure the strength of the heart fairly routinely, and that helps us guide our treatment long term.
Now, I know exactly the moment when I got into what I'm doing now, and when I knew that's what I wanted to do. What was that moment for you when you knew that you wanted to be a doctor, or more specifically, a cardiologist?
Well, I trained in Wisconsin. This was in the late 1980s. And at that time, the heart surgeons were doing a lot, but there was a new breakthrough in cardiology. And I trained in a very powerful cardiology program in Milwaukee. And then I met, a gentleman who was going to be my mentor. And he was bringing lots of new things that could be done without surgery. So when I saw him do some of these procedures on patients who were, having a heart attack, that was, I was fascinated that, this could work out long term. And so that's what got me into cardiology, because that was where I could go with new, sophisticated technology and to help people, who are really having a heart attack, or to help them avoid heart bypass surgery.
And how did you end up in Midland, Odessa?
After I finished training in Wisconsin, I wanted to come to a little smaller town, and Midland, Odessa met our characteristics of what we were looking for, and I was recruited by the people here in Odessa.
Oh, that's great. Well, you also have done a lot of good for the community. I know that you help out a lot of people in the surrounding areas as well, right?
Yes, we do have outreach clinics here in West Texas. The distances are quite a bit, far away. People have a hard time driving, especially if you're an elderly person. And some people have limited finances, they can't come 150 miles. So once a month I go to 6 different towns in West Texas, do consultations, see patients there, and only bring them to Odessa if they need any sophisticated treatments or investigations that are not available in their towns.
Good. So for those watching out there, what are the signs they need to look for when they know that they need to come and see you?
Well, typically, to see a cardiologist, one should probably see their primary doctor with symptoms, and the primary doctor would potentially refer them for symptoms such as chest discomfort, chest pain, shortness of breath, palpitations, lightheadedness, fainting, unexplained fatigue, rapid heartbeat. These would probably, sometimes people can have swelling in their legs that could, potentially indicate a condition called congestive heart failure. So for all of these would be most common areas for people to see a cardiologist.
Okay, great. Well, let's go through some of those tests and see how I do.
Okay.
And we're back on Sports Plus from Odessa, Texas at the Healthy Heart Center with the one and only Dr. Gadasalli. It's great to see you here. Thank you so much for having us.
Pleasure to meet you, Paul.
And I know we're going to be in here today getting checked out because I've got a little family history of heart trouble. So this is something you'd advise everyone to do, though, right?
Well, if somebody has symptoms that could be the heart and have risk factors for heart trouble, then we do advise that they come in for a checkup.
Okay.
So please tell me how you've been feeling lately.
I've been feeling good, but over the summer it was a pretty stressful time, and so there was a little bit of time. It's hard to tell because we're in Texas, and it's a little hot and sweaty anyway, but just feeling sort of a little bit overwhelmed and kind of feeling, a little bit of pressure on my chest.
So you've had chest pressure and felt a little sweaty.
Yeah. So no pain, but a little pressure.
What were you doing when you had the pressure?
Oh, just driving, which is the most stressful time, being in the car in traffic.
Yes. And how would you rate the pressure? Was it severe, mild?
It was very mild. I would say probably on a scale of 1 to 10, probably a 2.
A 2.
But still, just something to where I started thinking, you know what, might be about that time to make sure that I'm not falling apart.
Yes. How long did that last for, Paul, the pressure?
Just a few seconds.
A few seconds, okay. And you had a little sweating. Were you short of breath or nauseous?
A little bit, but I also kind of blame that on my questionable exercise routine and probably questionable diet.
Now, you've never had heart trouble before. Nobody's ever said you have heart issues or cholesterol, being high. Have you had your blood work done recently?
Oh, maybe about a year ago when I switched insurance, but no. So, but as far as heart trouble, no. Maybe broken heart, but besides that,
And you don't smoke.
no smoking. No,
You don't have diabetes.
no diabetes.
Okay.
So thankfully, there's probably a few good signs
Good
so far,
signs,
right?
yes. Please tell me about your family.
Sure.
Anybody have heart trouble, strokes, heart attacks?
Yeah, actually, my grandmother on my mother's side, she died when she was 60, and that was due to a heart issue. And then my grandfather on my father's side had an issue in his 70s. He had a heart attack and stents placed in, but he lived to be 93.
Okay.
And my uncle had a little issue as well, but in general, I would say out of a very large, both sides of the family, there hasn't been too many issues.
Yes. And nobody has ever said that you have a little high blood pressure when you've gone to a doctor's visit?
No, they might have told me to calm down, but but no, as far as not at a doctor's office. Yeah.
Would you consider your job to be stressful?
Yeah, actually, I do several different things, of course, and the show sometimes can be stressful. But in general, you know, I think it's all relative. Is it as stressful as maybe someone who drives an ambulance? Probably not. You know.
Yes. Well, we checked your blood pressure earlier and it was normal.
Okay. Great.
And we'll have to do some blood work, especially to check on your cholesterol.
Sure.
And your EKG has some minor abnormalities in it, nothing to be too concerned about at this stage. I'd like to listen to your heart here for a second.
Sure.
And after that, I recommend that you have an exercise stress test.
Okay.
And we'll describe that to you and get you going here in a little bit.
Sure. As long as it doesn't involve a catheter, I'm in.
It's a non-invasive test.
Okay, great. Thank you.
Let me listen to your heart. And then,
Okay. See if I'm actually living.
yes. We usually check for extra heart sounds or heart murmurs.
Sure. Extra heart sounds, huh?
Your heart sounds good.
Oh, good.
I don't hear any abnormalities.
Good.
Okay.
That's great.
We'll go and head on over to get a exercise treadmill test now.
Okay, sounds good. Well, I need to get on the treadmill anyway, so here we go for the stress test.
How are you feeling?
I'm feeling great. A little winded. Maybe I should exercise some more.
Yeah, but you did not have any chest pressure, whatever you had felt
Not
earlier.
at all.
You did not feel, so that's a good sign.
Yeah.
You did exercise for more than 10 minutes, which is very good.
Great.
This was our toughest protocol that we used.
Okay.
And then we got your heart rate up to 175 beats per minute.
Great.
Your blood pressure was fine. And when we look at your EKG, the tracings look normal.
Okay, good.
So you passed the treadmill test.
Hey,
Congratulations.
that's good to hear.
Yeah. This is an echocardiogram, and we're looking at all the 4 chambers of your heart. This big one here is the left ventricle, or the pumping chamber of your heart.
Okay.
And this is the left upper chamber, and this thing that's flopping in there is a valve that controls blood flow.
Okay.
This is the left side of the heart, and this is the right side of the heart. So we're looking at lower chambers and upper chambers. And we can also see that around your heart with this ultrasound. And we get really good information about how strong your heart is, how the valves are working, and whether there's any abnormality around the heart. And here everything looks really good.
Good. So it looks like I'm going to live.
Yes.
Okay, good.
Okay.
Okay, so we've gone through all the tests now. How did it go, in your opinion?
Paul, I think you did really well. We did do the stress test, and I'm glad to say you did well on it.
Great.
So after all the testing, my recommendations to you are to continue a healthy lifestyle. If you can implement some amount of exercise in your busy schedule, that would be good. And if you can moderate cholesterol intake if you can moderate your cholesterol intake if your cholesterol is high,
Okay.
by a low-fat diet, these are the 2 things I would recommend for you.
Cut out the energy drinks, right?
Cut out the energy drinks. Yeah, anything in moderation is good.
So to find out more about Dr. Gadasalli and the Healthy Heart Center, where can we find more information?
You can go on the web, on the internet, and look at healthyheartcenter.net, and also facebook.com/healthyheartcenter.
I'm going to go like it right now. Stay tuned for more next.